Doctor, also, now that you have also talked about the treatment involved in tongue cancer, I would also like to know from you: are there a few things, or are there something? Is there something that people don't normally know about tongue cancer? Because mostly people do have a knowledge about breast cancer and other types of cancer, but when we talk about tongue cancer, not many people know about it, because like you mentioned, that it is something that you develop on your own. I mean, if you consume too much of alcohol, or you eat too much of spice, or if you chew and these gutkhas and all these things, then only you develop this cancer. So not many people know about it. So are there something, or is there any important thing that people not normally know about tongue cancer that you would like to talk about today?
Yeah, I agree with you, Rajni. What happens is media, persons like you should keep on telling patients or people who are watching the TV and this media is number one, the moment you are taking gutka, you better be careful of your oral cavity because I have talked with lots of people who are consuming which when you they say nothing is going to happen. Marna to marna hai, that attitude.
Yeah,
Because gutka has become an addiction. It
true.
has become an addiction. I got a patient which you will not believe that they are saying that I cannot pass motion in the morning if I don't take this gutka. The moment he gets up in the morning, the first thing is he does not do anything. He searches for his gutka box and then taps it, put it in the hand, put it in the oral cavity, and then he goes to the toilet or newspaper and then sit there for half an hour. Psychological. This is not the fact there is nothing in relation to your tongue and for your bowel motion that comes automatic. But psychologically, he goes sit over there and then he passes. So what I wanted to tell you through the media is do not have this habits. Once you have these habits, so
Okay.
do not cultivate this habit.
And also, is there any myth related to tongue cancer?
Yes, Rajdeep. Everyone says, this is probably papam, what we have done in the Purna Janam and all that. And no scientific person, will believe this. Okay, then I'll tell you one patient where I saw a tongue cancer and then worms were coming out of the mouth. Can you believe it? That was an advanced stage. Then they say that this is a myth. This is something we have done in Purna Janam, and that is how the work. No, it's unclean. The flies comes and sits accidentally, and then the worms comes out. That happens everywhere. The breast cancer or thyroid cancer or any cancer. You keep it unclean, it comes out. Then the patient will have bleeding. So you have to be very careful because it erodes a major vessel. And there the bleeding starts and the patient will bleed to death. So that is a very, very important factor. Earlier stage, it is better because you identify the disease, you cure the disease. Later the stage will have problems because you have to cut whole of the tongue or half of the tongue for all that matter. So it's always better that you just have a earlier stage and do a screening.
All right. Thank you so much, Dr. Syed, for again coming to SQ TV Global and speaking with us. It was again such a pleasure having you on the show, and it was such an educational and informative show, like you always do. So thank you again for your time and doing the show.
Thank you very much, Red. Anytime I'm there for. Thank you very much. Take care. Stay safe. Bye.
All right, guys. That's it from SQ TV Global. Keep watching and do not forget to subscribe to the channel.